There's a lot of doom and gloom healthcare stories in Canada right now, but today we're going to talk about a good news story from Victoria, British Columbia. Rebalance MD has a really innovative partnership with the government's Island Health Authority. It's helping to reduce wait times for patients that need hip, knee, or other musculoskeletal surgeries. This private company's excellent health services have even attracted the eyes of other private providers from outside Canada.
My name is James Stone. I'm an orthopedic surgeon at Rebalance MD, a practice that's basically cradle to grave knee from childhood injuries all the way up through sports injuries, and then knee replacements and revision knee replacements at the end of the day. Before Rebalance, there was a collection of surgeons working in a less than coordinated manner. There were 4 offices in town with referrals going to multiple sources, from multiple sources, and really just a chaotic environment in terms of getting in the door for patients. Really not a very satisfying environment to work in. I'd come from fellowships overseas where they're much more organized because there's a private system as well. It reeked of amateurish, really, because there was no coordination. It was not a good environment. And then there's also we were running our own offices, so you're dealing with hiring and firing MOAs and basically day-to-day running of the office. Rebalance changed all that, so I do not have to worry about running the office. I don't worry about cleaners. I don't worry about when the lights come on, who's going to be there. I just show up to work and I work and I can focus on the patients.
Hi, I'm Stephen Fletcher from Rebalance MD in Victoria. So Rebalance was formed in 2013, or opened in 2013. We actually took a couple of years to get to that place, but it was at that point in time a Centre of Excellence for Musculoskeletal Care, which is orthopedics. And so we basically took a bespoke system where there was no coordination between all the different practitioners and brought everybody together. And we had a wonderful group of founding orthopedic surgeons that were frustrated with the system, frustrated with their inability to communicate with the health authority, with the ministry, and equally so with patients. And we're looking for more of a sort of a business model approach to improve efficiency and opportunities for patients.
When a general practitioner sends you to a specialist, there are 2 waiting periods. The first is the wait to have an initial consultation. The second waiting period is the wait to have surgery if it's deemed necessary. Rebalance helps with that first stage, assessing a patient's need and determining if surgery is necessary. Going to Rebalance for a hip or a knee problem is similar to seeing your family doctor. At the end of the visit, you're not left with a bill. Patients can go to Rebalance and get an ultrasound or speak with a specialist, and the government uses tax dollars to pick up the tab. Patients can, however, pay for on-site physiotherapy or purchase medical devices, like, for example, a knee brace. What Rebalance has done is bring some organization to the healthcare system. They're basically a one-stop shop. By coordinating a patient's journey from meeting with a specialist to receiving an ultrasound to physiotherapy, Rebalance has been able to cut wait time.
When we looked at the flow of a patient through the clinic previously, it was just had so many different gaps and so many different places where it was held up. So we've gone from a stack of paper to a digital format. And what we've done is created a platform where we have the ability to triage within 5 to 6 days all the patient referrals that we're getting. We've gone from roughly 500 referrals a month when we first opened, with a waitlist size of 500 people waiting an average of 9 to 18 months, to now getting 1,800 referrals a month, a waitlist size of upwards of 4,500 patients waiting an average of 8 weeks. So you can see the tremendous change in the volume has dramatically increased, yet the wait time has basically dramatically reduced. And we've created a team around that to get the patient as simplistically in front of the right person at the right time.
Before, it would be a referral comes in from a GP who, okay, maybe that guy does feet, so I'm going to send him there. And then you get the referral and like, no, I don't do feet, reject that referral. Well, that's time added onto that patient's journey. Then they go to the next one. Oh, no, he just does shoulders. He's going to reject that. And so these referrals would bounce in and out of offices. And depending on how quickly the referrals were reviewed, that could take a long time. Now, with this single referral, I think if you do talk to the GPs in town, they love it because they just know musculoskeletal, whoosh, rebalance, out the door. And then we can decide who it goes to with our triaging.
We spoke to 2 Rebalance patients to see what their experience has been like.
My name is David Graham. I live in Brentwood Bay, just 15 minutes out of Victoria. I've had deteriorating knees for some time. I finally could not manage without getting a knee replacement, so I went to my own doctor and he referred me to Rebalance. All the way through this, I knew what was coming, I knew what to expect, and if something came along where I needed an answer to something like, should I get off this painkiller now? Should I do less exercise? All those kinds of questions was a phone call away and cleared up right away so I could get on with my healing. I think the whole system has to be looked at, and I think this model, Rebalance, should be looked at carefully in other jurisdictions because it seems to be working very well.
My name is Ann Hill. I live here in Victoria, BC. Arthritis brought me to Rebalance. My right hip and knee were severely affected by arthritis, and I was referred by my doctor. It's great to have everything in one place, including the x-ray, so you never have to worry about trying to get into a lab at the hospital or somewhere else.
One thing that Anne and David both appreciated was how easy it was to get a hold of someone at Rebalance to get an answer about their case.
Within 24 hours, I'd have an answer. I didn't have to worry about trying to reach my surgeon because I could just email or phone, leave a message, and I'd get an answer right away. Going through a system where all of these things are separated would be very, very difficult. And it's a hard journey to begin with for the recovery, so to try and do all of that would be an extra burden in a big way.
It was interesting talking to Dr. Stone because he not only works at Rebalance, he's also a surgeon in the public system. We wanted to know what can be done to reduce that second waiting period, the period from when a patient decides to proceed with surgery to when the government actually provides it. Dr. Stone indicated that often the government doesn't have enough staff to assist surgeons with surgery. This is just one of the reasons why there are backlogs.
Do you have a lack of staff at Rebalance?
No,
So why is it that the government can't meet the needs, but you guys can?
because we have 2 administrators.
Is there a huge amount of administrative overhead in the public system? Is that what you're observing?
I don't know what their overhead is, but I know there's a lot of administration in the hospital.
One thing is certain, the Rebalance partnership has helped to reduce patient wait times and patient suffering. Governments shouldn't be afraid to look at more partnerships when it comes to delivering health care.
Time for innovation is now. Otherwise, we won't have the public healthcare system. It'll collapse.
If you're interested in learning more about health reform, please visit secondstreet.org.